I recently did a video on Ozempic, but now I want to do a video on Mounjaro. Now, Mounjaro is a very similar medication. Apparently, in several studies, it works a little bit better than Ozempic, more weight loss, less time. Both these medications were primarily used for regulating blood sugars with diabetes, but they also found that it helps you lose weight, which makes sense because anything that improves blood sugars will obviously help you lose weight. So, the first thing I want to say is Mounjaro does create some really interesting effects with weight loss and blood sugars. There's no doubt. Actually, it can even improve insulin resistance and decrease your A1C, which is an average blood sugar for 3 months. So I'm not going to say that it doesn't work, but it's expensive. It's like $1,000 to $1,300 a month. And it does come with other side effects other than just being expensive. But the big question is what happens when you come off the medication? Does it actually correct the problem? The answer is no. You have to keep taking it for it to work. Do you end up taking it the rest of your life? Is it healthy? What are the long term effects? Well, we don't know. But the short term effects are the following: nausea, vomiting, diarrhea, constipation, gastroparesis, which is a situation where your stomach is a bit paralyzed. Food goes through very, very slowly. Another side effect would be abdominal pain, dizziness, lethargy, low blood sugar, as in hypoglycemia. Various kidney problems, like kidney disease, could happen as well. And even retinopathy, which is a problem with your retina. Let me just kind of touch on that for a second, the slow metabolism. People that have a slow metabolism actually have a very efficient metabolism, probably from dieting in the past. You go on some diet, and then your body adapts and compensates, especially if you go on a lower calorie diet and then becomes more efficient. So now it can run on a smaller amount of fuel. It doesn't want to waste this energy. So it's very conservative. So it's like a car that gets a lot of miles per gallon, right? Versus the very inefficient motor, which is a gas guzzler. So this is really a survival thing that we have in our genetics. So anything like fat storage is survival to the body. And so anytime you try to lose weight, the body will resist it because you're getting rid of this potential survival. So when we use a drug to bypass this whole mechanism to try to help you lose weight, you really have to understand what's happening to the body internally. You're artificially mimicking these two hormones because these drugs act to mimic two different hormones that are in your small intestine. One is called GLP-1 and the other one is called GIP. They're drugs that mimic these hormones. So my question is it possible to create this similar effect but without the side effects? Can you use something more natural? Is there such a thing as some type of maybe herbal or plant-based agonist for these two hormones? And the answer is yes, there is. And I put a link down below of the research on that. And it's called phytomedicine. You're using plants as medicine. But the cool thing about it is there's very minimal toxicity and there's all sorts of properties, especially things that relate to blood sugar control and many other effects in plants. I mean, there's probably about at least 400 different chemicals that can help blood sugars from different angles. These two hormones that these drugs are mimicking raise insulin to lower the blood sugar and also reduce the production of glucose from the liver. That's called gluconeogenesis. And they also affect the digestive system. They actually make you feel full. They help reduce the appetite. So it's going to curb your hunger and help you eat less. So my question is, number one, is there something non-toxic without the side effects? And is there something you can do long term to create this same effect to add it as a part of your long term healthy lifestyle instead of a short term, very expensive drug approach? And I forgot to mention lowered stomach acids. So when you start lowering your stomach acids, that's going to create all sorts of issues with ability to digest protein, absorb minerals, kill pathogens. So there's a whole series of consequences that can happen just from that. So I always like to think long term. Is that the best long term solution for a person? I understand that your metabolism might be very efficient and it's more difficult. And this is part of the phytomedicine data. So there's four herbs that can create this effect. Number one, berberine. Number two, curcumin. Number three, cinnamon. Number four, Panic's ginseng. Now, I'm not recommending taking all of these. I would just pick one and try it out. In addition to two other things I would highly recommend, especially if you want to lower your appetite and be able to do something that fits within your lifestyle. And that is this, the healthy version of the ketogenic diet, which is a low carb diet with intermittent fasting. That ultimately is a wonderful way to correct problems with your blood sugar and help you lose weight and keep it off. Now, if you want to know how to do healthy keto with intermittent fasting in a very simple video, you should watch this one right here.